cancer treatments
Yeah.
and gallbladder are not essential services. But
No.
you know what shocked me?
Yeah.
I was reading on the internet that they still consider euthanasia and assisted
Yeah.
suicide as an essential service.
Yeah.
So if you want to be killed, if you're suffering and you want to be put down like your dog,
Yeah.
you can go and have that done now.
In certain provinces? Quebec, I did.
All over Canada.
Oh,
Yeah.
yeah. Is it?
Yeah. And they've even expanded it now to people who are mentally ill and,
Yeah.
you know.
Yeah, I was aware of that to a degree.
But why would that be an essential service? Why can't you
Well,
wait whether you kill yourself now or later?
Yeah, right.
Yeah, I mean, it's not really,
yeah,
that's considered essential.
yeah. Well, someone is making that decision in the government.
I wonder who makes those decisions.
Well, it's got to go right up to the top.
Yeah.
It has to be approved by the government and handed down from the top. Yeah.
You'd wonder if is there some sort of a committee or something that makes that decision?
Ministers in charge, and cabinet ministers in charge, and Trudeau's in charge. Yeah. And
Yeah, the Minister of Health,
Minister of
like
Health.
Dr. Tam, I guess.
Yeah.
She would be the one to make that kind of decision. So
Yeah,
she
yeah.
considers euthanasia and assisted suicide as an essential service.
Trudeau's involved, was in that, and is involved in that. Always has been. And
Yeah.
so is the ministers under him. So to legalize it, it has to be passed by Parliament, right?
Mm-hmm.
And they have to get the bill and get it passed. That is allowed to be done as an essential
Service, yeah. During this time of the COVID virus.
Right.
Now, the
Yeah.
worst thing, though, well, that's bad, euthanasia and assisted
Yeah.
suicide. But another essential service, which I was shocked by, because in the States, lots of American states have canceled this, and that is abortion.
Yes.
The whole states have said, no, we're not going to, you know, whether you agree or not with abortion, it's not essential.
Yeah.
And also the problem is, it's taking away important, like face masks and medical equipment and medical.
There's no doubt that virus interrupted a lot of things.
Right.
Health-wise. Yeah.
So in the States, they were canceling abortions.
But
Not all of them.
They're looking at the big picture on amount of deaths and everything else.
Right.
To make these decisions. All right. In my mind, that's what they're doing.
Yeah.
Yeah.
In Canada,
And which is the best route to go and the quickest route to go to get everything back to normal.
back to normal, right?
Right.
So you don't disagree with having abortions as essential services, more essential than cancer and gallbladders? We'll go to the Canadian perspective.
Yeah.
On CTV News, I think
Yeah.
it was about 3 weeks ago,
Yeah.
somebody must have brought it up in Parliament,
Yeah.
you know, that abortion, I guess because of the Americans.
Yeah.
They heard the Americans were stopping
sense.
abortions,
Yeah, makes sense.
and they said, well, in Canada, they call it women's reproductive health. They don't call it abortion.
No.
Women's reproductive health services must be maintained, and it's by province, right? Province and territory. So all the provinces and territories in Canada, their premiers all unanimously agreed that abortion is an essential service.
And it's a law now. It's a law. Yeah, it's been passed by Parliament.
What law, Ken?
There has to be a law for that to happen.
For what to happen? Abortion, you mean?
Abortion. Yeah.
Well, there.
Or euthanasia, right?
Euthanasia?
Yeah.
Yeah. Well, euthanasia is legal. They legalized it
Right.
a couple of years ago, I think.
Right.
But abortion isn't legal. It's just not illegal. I think it was 1988. Morgan Taller's.
So the original question on abortion was what?
Sorry?
The original question on abortion was what?
I think initially it's Trudeau's father,
Like,
Pierre.
what are you asking about abortion again?
Okay, well, today we're just talking about the COVID virus.
Yeah.
We're just sort of wondering what people think about should abortion be an essential service during this COVID virus? If you can't get cancer treatment, you can't get your gallbladder taken out, should we be able to kill babies during the COVID virus, and we're paying for it too. See, the other problem with abortion is that it's made out that it's completely safe and so on, but a lot of times, not a lot of times, but certainly a significant number of times, the women would have severe hemorrhaging, or they would have other complications, and they are sent to the hospital.
Oh.